Hi, I'm Mike Dilk, and you're listening to the Relax Back UK show, the show that explores all kinds of health topics relevant to you, your family, and your friends. Each week, I talk to expert guests from a range of backgrounds to inform and entertain you. So please do join the Relax Back UK family and stay tuned.
Hi, and thank you for joining me on the Relax Back UK show this week. My guest is Dr. Emma Anwofa-Mensah. She's a consultant dermatologist, and she has created House of Medics, which is aimed at all people who are working in the medical world.
Back in the day, we had the hospital firm, which would have the consultant, the junior doctors, the nurses, the ward matron. We'd all go on the ward rounds together. We'd all see patients together. I'm saying we, this is before my time. But, that's how we know that the traditional firm used to work. But now everyone is just so busy. The nurse doesn't have time to come on the ward round. The nurse has got so much to do that, they're just going to have to find out what happened on the ward round. We'll tell them later. So we don't really have that family structure in medicine anymore.
It also has an objective to combat the bad health information that we all see on social media.
So I think there's a problem with social media where there are things that are definitely misinformation, and that's one category. But then there are things that are partly true, but are completely blown out of proportion on social media.
This show is interesting for medics, all people that work in a health profession, those that are thinking of getting involved as a future career in health of any sort. And it's also interesting for regular people like me. So please do stay tuned for a great show. Thank you. So my first question to Dr. Emma was, what is the House of Medics and what made you want to create it?
Sure, yeah. The House of Medics is a community for all healthcare professionals. We move across all disciplines. And we basically wanted to create a platform where people can meet other medics, feel supported, meet people with similar interests, but also a platform where we could provide mentorship for students who might want to get into healthcare careers. And through that, we've ended up doing lots of outreach work, both in the UK and in West Africa. And we just do a lot of work encouraging young people who maybe don't have medics to look up to, who they have access to get into healthcare careers. I'm the first doctor in my family. I didn't have people to ask and, people to lean on when I was applying. So really just to provide that support for young people.
Okay.
And also we founded it during the pandemic when we realized that actually a lot of healthcare professionals are quite isolated, are really close to burning out. So we just wanted to make sure that we can try and bring people together.
Okay. That very laudable objectives. But I mean, there are professional bodies already for medics, for nurses, for all sorts of people involved in healthcare. So you felt they didn't necessarily fulfill everything that was required.
Yeah, because I think the bodies that already exist are very much, so for example, you've got the GMC, which is very much about regulation, making sure that you are doing the right thing, making sure that you're competent as a doctor, which is of course super important, but it caters to the public more than it caters to the profession. And then you've got things like Royal Society of Medicine, Royal College of Physicians, which just feel really impersonable. So it's sort of like you pay your prescription, but if I'm going through something, or if I want to just meet some other people, maybe just have fun, those bodies aren't going to help me do that. They're not going to help me feel more connected to more medics. They're just, they run courses and events, but it's very much educational. What we really wanted to do was to bring that family vibe back to medicine, because when you look at the history of things like the Royal Society of Medicine, that's what they were originally founded on. It was about community. It was about how do we share new information? How do we learn from one another? How do we make sure that everyone feels supported? And I think over time, just as things have grown and got to a large scale, that's been lost.
And certainly a lot of the professional bodies, or maybe all of them, are open to, there's one for doctors and one for nurses, and they're all in silos. The House of Medics is open to all health professionals, is that right?
Yeah, correct. Yeah.
And
and we thought that was important.
Yeah. Sorry, I keep interrupting you. Why is that important? What's the kind of driver behind that?
Yeah, because I think a lot of our struggles or a lot of our concerns, it goes across board. And like I said, the motivation really for starting it was during the pandemic when it's called a House of Medics because we were actually living in a house together. So it's myself, my husband, who's a doctor, and my good friend, Aaliyah, who's a pharmacist. We were living together. And we were like, wow, we're so lucky that we have each other because we can just come and talk about, the pandemic was crazy. You could have never imagined that something like that was going to happen. And we were all going to work every day, just completely uncertain, not knowing what was going to happen next. And we just thought, we're so lucky that we can just come home and debrief. Whereas I knew a lot of my colleagues, for example, colleagues that lived with elderly parents had to move out of their homes and live in hospital accommodation or hotels because they were worried about bringing the virus home, things like that. So a lot of the things that we aim for, we all want to do the best things for our patients. We all want to improve both, in terms of our academic skills, but also in our social skills, our ability to do the job. We want to be supported in terms of our mental health. That is across board. It doesn't matter what specialty you work in, just within healthcare itself, we have a lot of the same concerns and a lot of the same aims.
Okay. So yeah, so you touched on it there, but as well as being beneficial for the healthcare professional, whether they're a doctor or a nurse or whatever, you feel that this approach is ultimately better for the patient as well.
Yes, I think there's so much to be said for multidisciplinary learning, to really know, okay, what does the nurse actually do when I don't see them? What does an occupational therapist actually do? Because then you how to direct patients, who can help you with what, it's unfortunately we don't work in the usual firm anymore. So, back in the day we had the hospital firm, which would have the consultant, the junior doctors, the nurses, the ward matron. We'd all go on the ward rounds together, we'd all see patients together. I'm saying we, this is before my time. Um, but that's how we know that the traditional firm used to work. But now everyone is just so busy. The nurse doesn't have time to come on the ward round. The nurse has got so much to do that they're just going to have to find out what happened on the ward round. We'll tell them later. So we don't really have that family structure in medicine anymore. And the other thing that stops that is the rotations. So, for example, junior doctors rotate every 4 months. So, by the time you get used to a ward, you get used to the people on the ward, it's time to rotate again. So that whole, that really close core group, that core family that we had during medicine is not there anymore. And when I speak to older professionals, they do say that, they think it was better back then. Things seem to work quite well.
Okay. So House of Medics is very much a national thing, is it?
Yeah.
Okay. So, people are members all over the country.
Yeah, and also abroad, we've got members in Ghana. We actually have a House of Medics Ghana team who do work whilst we're here. They do lots of outreach work and things.
Okay. Um, so as you've got all these people joining, that they're members, what kind of help do you, I mean, you've mentioned a little bit about, this idea of feeling like a member, but practically what kind of help do you give to members?
Mm. So probably the one of the biggest things we do is our mentorship scheme. So we match students. So let's say there's a student that says, "Oh, I want to be a dentist." We find a dentist, we match them, and it's just the introduction. But then also we provide a bit of structure in that they should make sure that they're meeting, and it doesn't we don't encourage them to meet face to face, just online or even just by over the phone once a month, and then we provide certificates for them, just putting a bit of structure there to make sure that both parties are getting a lot out of it, because even for the mentor there's a lot to gain from being a mentor. There's lots of skills, leadership skills, to be gained from it, and things that you can add to your CV and your portfolio. So that's probably one of the main things we do. And then also just providing a network. So someone might contact us and say, "Oh, I've got a project and I'm really looking for," it could be something really niche, like a physiotherapist that has a specific interest in lower back pain. And then we can say, "Oh yeah, we'll check our database and see if they're happy to be put in touch." With time goes on, that's just going to grow more and more. And I think it's going to be really valuable to a lot the members. And then of course there's the events, just giving people the chance to come meet people that are like them. Not all of our events are educational. A lot of them are just social and fun, just to be able to go and meet another group of medics. People really enjoy it and value it.
Okay. Do you reach out to people, well, kids at school really, if they're wondering if they want to go into the world of medicine and give them some help and advice as well?
Yeah, so we have an educational program where we work with schools and we're invited into schools to hold workshops. So, we might do like a whole day workshop where we have different professionals that come in and speak about what they do. And it often has practical sessions like we teach them first aid, and I do this suturing workshop usually where I teach them how to suture a banana. So things like that just really gives them first-hand experience to be able to ask, the real questions, which if you don't know someone, firsthand or close, you probably wouldn't have that opportunity. So we do a lot of work with that in our educational arm. We also get invited for panels just to come and speak to students and things like that. Obviously, with schools, we want to make sure that we're approaching them in the most appropriate way. So we always do it through, the proper channels, through the schools themselves.
Okay. Now, one thing that I know House of Medics gets involved with, and you personally get involved with, because there's a lot of medical misinformation about. And actually, before this chat, because I'm nosy, I had a little bit of a nose on social media, and I think I found a subject that might be a bit of a touch point for you, and that's spearmint tea and acne. I found a great video of you talking about that. And what's the situation with spearmint tea and acne, and what led to that particular video?
So I think there's a problem with social media where there are things that are definitely misinformation, and that's one category. But then there are things that are partly true, but are completely blown out of proportion on social media. So if we use this spearmint tea as an example, there are some studies that spearmint tea can maybe theoretically, we still haven't proven this, but there's maybe some evidence that it can change the male hormones within the body, so the androgens, and therefore be helpful for acne. And this is something that if you say to a dermatologist, for example, if I go to work and I say to my dermatology colleagues, oh, do you recommend that people drink spearmint tea for their acne? Most of them are going to say no, like that's not a proven treatment. But if you go on social media, there are so many videos and people are pushing it like it is the cure for acne. And that's the problem. So there's misinformation, which is one category, but then there's this whole thing where I call it social media medicine, where there's maybe a bit of evidence for something that's still not proven.
A
The
slight
evidence,
grain of truth.
exactly, yeah. The evidence isn't robust enough for it to be incorporated into guidelines or for us to promote it widely. But it's all over social media. And then for people who are obviously just consumers of information who aren't in the medical field, they're going to think, well, all I need to do is drink spearmint tea. And the problem with that is it delays their treatment. And acne is a medical condition. It can cause permanent scarring. So you want to treat it early. You don't want to be waiting, faffing about with tea when it's not going to work.
And that comes across in the video I discovered. It's a different Emma that is presented in that video to the one I'm talking to now.
Yeah, definitely. I think
I'm not sure I want to meet that Emma that's in that
oh,
video.
I do quite like using humor and trending sounds and things just to get because there are some people that are just not going to watch a video of me talking. So while I do the videos of me talking, then it's always nice to switch it up and use humor and different sounds and things.
Good. But so, I mean, from a serious standpoint, House of Medics does get involved in trying to combat this medical misinformation. So how exactly do you help with that?
So yeah, when we first started, because we started in the pandemic, we weren't doing much in the way of events. But what we did do was create the YouTube channel and give people a platform to speak about what they do. And the main aim initially was actually all for students. So it's like, oh, let's get a physiotherapist on so that students know actually what a physiotherapist does. And if they're not sure what career they want to go into, this video can be helpful. And then over time, the YouTube channel grew and we realized actually let's target this misinformation because I started creating content on my own social media platforms as well. So then it was like, let's have people on who know their field. And then not only can they educate students about what they do, but actually let's start to educate the general public and create, credible videos with credible medical information that's trustworthy and that people can actually use and incorporate. And that's been really great. Through that, we're part of the YouTube Health Shelf, which means that we're sort of accredited on our videos. It says at the bottom, this video features someone who is a qualified medical profession. I'm paraphrasing, can't remember exactly what it says, but having that platform being part of the YouTube Health Shelf is really great. And then we're also part of the World Health Organization FIDES team, which is again a group of healthcare professionals who have come together to target misinformation and to create credible content.
Okay. All right. So if people are looking for sort of health information of any sort, can they do a search on your YouTube section?
Yeah. So you can search. So you can search, for example, um, just trying to think. Let's say scabies, and then write House of Medics on YouTube, and there'll be a video there.
Okay. And so all these things have someone in House of Medics kind of okayed them,
Mm.
right?
Yeah, so it's usually us. Yeah, so we film in our home studio. My husband does all of the filming and editing, and because he's a doctor as well, it enables him to cross-check the information that's given. Then, of course, look up things online and always double check. Even me, if even if I'm creating a video about eczema, eczema is my bread and butter. I treat people with eczema 10 times a day. I still check. I'll go online and check, what I'm saying before I record the video. You just always want to make sure that, everything is legit because once it's out there, it's out there.
Yeah. Excellent. All right. Um, I think that's a very useful thing because actually, so I'm not a medic. I'm not a medical person at all. I just speak to a lot of people that are, and I get upset when I see things that are obviously untrue, and frankly, some of them just bonkers. It upsets me. So it must really upset medics, people who that is their world. So no, I'm very glad to hear that for sure. Um, Other things that House of Medics gets involved with. Now you mentioned a couple. Um, there's an education program. Can you mention a bit more about that?
Yeah, sure. So that's actually what I mentioned about what we do when we go out into schools and help people. We run workshops and run seminars, panels, just to tell people what it's like to study different courses, what the practicalities of working within that is. And we've been really privileged to work with some really great colleges and schools and actually have a few more partnerships coming in 2025. So hopefully it'll be, a really solid part of what we do. And I think it's probably one of the most rewarding things that we do.
Okay. And then the outreach program. That's you mentioned that as well, but could describe that a bit more.
Yeah, so the outreach work is what we do mostly in Ghana. And this is something that I was actually doing pre-House of Medics. So before this, I had an organization called Friday Born Designs, and I was basically making African-inspired clothes and accessories, selling them, and then taking the profits to Ghana to donate to orphanages and things. And then once I graduated, I started when I was a student. Once I graduated, I turned it into a medical outreach. And what initially started was free health screening for Ghanaians in disadvantaged areas. So we screen for things like high blood pressure, anemia, um, diabetes, hepatitis. We'd like set up pop-up clinics and screen people for these conditions, and then just provide them with free medical advice. And I have a team of doctors in Ghana that helps with that. And then once we founded House of Medics, that grew even bigger. So we do health screening, but we've also done different forms of outreach. We were in Ghana this summer, and for example, we did a Girls Empowerment Day and opened up a sanitary pad bank for, a really big school. We realized that period poverty is actually a huge problem that prevents lots of young girls from even being able to go to school. We also held a conference for healthcare professionals, mostly junior doctors and medical students, to talk about the future of healthcare in Ghana, to encourage them to get involved in research. And that was really amazing. We had the provost of the University of Ghana with us and was our keynote speaker. And we also had a renowned dermatologist from America come and speak. So just to really encourage, obviously studying medicine in sub-Saharan Africa can be really tricky because a lot of people are studying in resource poor areas. So we were just trying to open up, avenues and spheres just to encourage students to get involved in research, to look at policies, because, it's the young people that are hopefully going to be able to change the health system in those areas. So lots of different work. And then, like I mentioned, whilst we're here in the UK, we have a team in Ghana that continues to do the work while we're abroad. So they're going out into schools to teach them about, basic hygiene, encouraging them to keep themselves safe, doing health screening and all things like that.
And so it sounds like these things are very well received.
Yeah, very well received. And there's actually quite a few different organizations that do it in Ghana as well. So it's really nice to be able to link up with them and to, have synergistic views. So then we put all our resources together and we can do it even better. So definitely very well received and again, really rewarding.
Yeah, good. Back to things in this country. I want to ask you something that might be slightly off topic, but it has been in the news a lot recently, I've noticed. And this is the idea of physician assistants. Now,
Mm.
they have existed
Associate.
for a long time in the NHS, but recently they've been in the news. So, two questions really: are physician assistants? Do you have them as members of House of Medics? And what are your thoughts on how they're used? Because there's been a lot of discussion and frankly argument recently about that.
Yeah, and it's become a really controversial topic. So they're called physician associates in this country. I think they're called physician assistants in America. And we
Okay.
do have members within the House of Medics who are physician associates. So I've worked closely with physician associates both in A&E. On my oncology job, I had a great physician associate, and then in dermatology as well, we have a physician associate. And I've had amazing experience with them. I think one of the ways that they're so helpful to the medical team is, like I mentioned earlier, junior doctors rotate every 4 months, but physician associates are often attached to a team for much longer. So they can become very, very, very skilled in their particular area. They're a huge asset. An experienced physician associate can help with so much. And especially, for example, the time when I worked with them in A&E, I was only my second year out of medicine. A&E is very crazy and scary place to work. And the physician associates were often very encouraging. They were able to show me around and help me. So I think having physician associates in the team can be an absolutely huge asset, and they can really help both doctors and the wider team. And they're often able to do lots of different things. I think the reason they've become somewhat controversial is where in certain fields, and I don't know for sure, but from the news, it sounded like, particularly in general practice, in certain specialties and in certain fields, it feels like they're being asked to work beyond their capabilities and not under the supervision of a senior doctor, which, from my basic understanding, is not how it was ever meant to be. They're
Mhm.
always meant to be quite closely supervised, um, and able to
Certainly, that's where I've so in on the news.
work.
That's the impression that I've got, that people have gone to a GP surgery and seen a physician associate and thought it was a GP.
Yeah.
That's sort of what's come across in the news.
Yeah, and I think that's the problem where people, it should always be clear to the general public who they're seeing. And just because it makes a difference to what they can do. So, for example, physician associates can't prescribe, they can't order tests that involve ionizing radiation. So, for example, they can order ultrasounds, but they can't order X-rays. I think as a patient, you need to know who you're seeing and what they're able to do. And I think that's where the problem is, where and this isn't unique to physician associates. It can happen to pretty much anyone working in the NHS, where we're so stretched, people end up working beyond their capabilities, and then the risk is putting patients at risk of, seeing someone who isn't able to actually, provide what you need, and that's the problem. I think the real issue is, why is the NHS so stretched? Why are we all, not being supervised? Why are we not working the way in which we know that we should be working to be able to deliver safe care?
Yes. So in fact, this question is more of a symptom of a larger problem.
Absolutely. Yeah,
Yeah.
yeah.
And that larger problem, we're not going to be able to solve now in this 5 minute chat. That might be a subject of a whole series, which I'll have to invite you back for. So and if we could solve that, we'd probably be prime minister or running the country or something, wouldn't we?
Yeah.
So perhaps we should just park that for now. But I think it was worth touching on, because it isn't it an
Mm.
important topic. And I can imagine, given the current situation, House of Medics could well be helping physician associates in the future. Probably are
Yeah.
now.
Yeah, yeah. No, we do have physician associates in the team. And yeah, I mean, when years and years to come, when people ask me, oh, what's your dream for House of Medics? Years to come, I'd love for us to be involved in policy and in high level decision making. I think because we've got such a young audience. I think, that's often when something isn't working, often you need, younger, fresh minds to get involved. And I'd love for us to be involved in, those high level conversations.
Good. I have absolutely no doubt that you will.
Thank you.
Judging by the slightly scary video talking about spearmint tea, again, I have no doubt that you will. Now, if people are listening to this, and well, two things really. If they are in the world of professional healthcare and they would like to become a member, what do they do? How do they go about doing it? What does it cost, if anything? And also, if people aren't in that world but want to get some really good, clear, correct information, either for themselves or perhaps if they want to have someone to come and talk at their school or whatever it might be, how can they go about doing those two things?
Yeah, so all of our information is on our website, and that's www.houseofmedics.org. And then there's a big yellow button that says join us, and it's free to become a member. You just fill in your details and join. Separate to that, we have something called the Partner Scheme. That one is a paid subscription, and it just gives you, free access to certain events, some exclusive merchandise, things like that. But I think the most thing for the partners is for people that just want to support our work a bit more, and to support what we do, particularly abroad and the charity work and things. And then, yeah, for those who want to receive the information, probably the best place to find it all is on our social media channels. So on YouTube, we're House of Medics. And then on Instagram and TikTok, our handle is @We Are House of Medics. And, we're putting out videos all the time, several videos a week. And like you mentioned, you can also search, the archive of videos to get the information that you need. And we also have our Winter Ball coming up on the 7th of December, which is like an annual celebration of everything that we get up to. So if anyone is watching and wants to, or listening and wants to attend, then they absolutely should. All the details are on the website.
Okay, just tell us where that is.
So that's going to be in central London at Sheraton Grand Park Hotel on the 7th of December.
That sounds fantastic. One final thing. There's this House of Medics talent, which is a little bit more than providing videos on the YouTube that have correct and useful information. You actually have a pool of talent. Just mention that.
Yeah, so that's actually something that we created last year. So it's one of the more new things. And it's basically where a lot of brands are looking for healthcare professionals to help them with their social media campaigns. So we have the bank of talent where the brands can contact us and say, oh, do you have any dietitians? And then we can put them in touch. And it's great, it helps the brand to be able to find credible people, and also helps our members to be able to have more streams of income. Because as you know, from all the strikes that have taken place this year, people are struggling with, just relying on just their NHS salary. So if not everybody is, but for those who are social media inclined, they can get involved in that. And it's, beneficial for both parties.
Good. All right, Dr. Emma, thank you so much for chatting. Absolute pleasure.
Thank you very much to Dr. Emma, my guest on this week's show. Thank you very much to you for listening, and have a healthy week until next week.
Thanks for listening to the Relax Back UK show. Join me, Mike Dilk, again next week for more fascinating interviews and chat. If you're listening to the podcast version, please subscribe, like, and share it with your family and friends. And have a healthy week until next week.